Good afternoon. I'm Dr. Libby Cope, Health Officer for the Makah Tribe, and this is the update for March 2nd, 2021. Just going to make my video a little smaller here. There are no new cases in Nia Bay since November 23rd, 2020. We are currently working on our vaccine efforts and vaccinating all 6 tiers. Our vaccine clinics are continuing at the community hall on Wednesdays from 9 a.m. to 5 p.m. and these are by appointment. In order to get an appointment, please call the clinic's front desk, which is 360-645-2233. You must be registered with the clinic and we can help with that. As far as the tiers go, we are certainly open to a number of people who may not be connected to our systems or following us on the STIC Facebook, etc. And so we're really hoping that those people who are connected, who are seeing this video right now, can reach out to your Makah friends and family, enrolled or descendants, and make sure that they know they're eligible for the vaccine. If they don't want to travel here, I'd be happy to work with them and see if we can connect them to any of their local clinics as well. But at the minimum, they are eligible for the vaccine here at STIC and we want to help them. So please let them know. We're relying on, again, people who are connected, watching this video right now, connected to our social media, to really reach out and make that personal call. Also, we'll just add to this slide, if you have friends or family who want more information about the vaccine and don't just want to go to a website, I'm more than happy to talk to them personally. They can call the COVID-19 question and concern line, and that number is at the end. But their phone calls do get routed to me, and I will make personal phone calls for anyone who has concerns or questions, and I would love to just give them all the information that I have. So again, it's enrolled and descendants, all of their household members 18 and older are eligible for the STIC vaccine clinics. The Johnson & Johnson vaccine was approved this weekend for emergency use. We are not planning on using it here at STIC just because we don't have any advantage to using it at this time. The single dose is just as effective as 1 dose of Moderna. So if someone is convinced they want to only have 1 dose, then we could use a single dose of Moderna. That's absolutely not recommended. You'll be more protected if you've had both doses, but that's why that's not seen as an advantage for getting the Johnson & Johnson vaccine. If the availability of supply or the storage turns out to have some sort of advantage, we would look into at that time trying to get some Johnson & Johnson vaccine, but right now we're not planning on doing that. So this is just zooming in on that chart to show that the efficacy of the vaccine is lower than the Moderna vaccine. And again, just 1 dose of Moderna is probably at least as effective as the single dose of the Johnson & Johnson vaccine. This chart is actually located on our STIC website and gets updated regularly. It's put together by the Northwest Portland Area Indian Health Board. So if you want more information about all the different types of vaccines that are out there, please check that out. In the news about the 2 new variants, so there's 2 new variants that have not yet been called variants of concerns, but they are being watched and studied. One is common in California now, and the other is spreading in New York. So again, they're just being researched. It does appear that the vaccine seems to work, at least on the variant in California. We will continue to monitor this very closely. The variants of concern that we do know about are the same 3. And currently the one that is most prevalent in Washington State is the one that originated in the UK. There are 39 cases. So far, the vaccine seems to be working, which is good because it's more transmissible, and some studies think that it might lead to more serious illness and death. The other 2 variants, we still have a lot more that we need to know. Good news is that the South Africa variant so far seems to be susceptible to the vaccine. Again, we need a lot more research to know for sure, but that is promising. No cases of that one in Washington State yet. There's one case of the variant that originated from Brazil, and again, still need to know more about those viruses. Clallam County is still high risk. The percent positive is 2.6, so that's gone up a little bit just in the last day. They had 2 new cases in the last 24 hours for a total of 14 active cases. Their vaccination continues to be relatively high, and I know they're working on continuing to do more vaccine efforts, which is good. And this is just where that data comes from on Clallam County's website. And this is just a visual graph of what that looks like. And I do like to point out that while the trend is continuing to go down, which is good, it is still definitely considered high risk and above our threshold for what is considered safe. In response to the spreading UK variant, Washington State has put the roadmap to recovery on hold. So none of the regions will be progressing to phase 3 at this time. And we will just have more information in the next probably 2 to 3 weeks as we get more info about the variants that are spreading. And this is just another visual of what's happening in Washington State. Again, it's definitely decreasing, which is excellent, but even at decreasing, it's above the peak of the second wave at the end of the summer. I just want to kind of hit home on wearing masks and how important that is, no matter what right now, even if you're vaccinated. So we've really got to make sure everyone is continuing to wear masks. When you wear masks, it protects others from you if you possibly have the virus, and it also protects yourself if you're around someone who has a virus. We want to also remind you that it's definitely not a substitute for social distancing, and masks should be worn in addition to staying at least 6 feet apart, especially when indoors with people who don't live in your household. Obviously, there are some instances where staying 6 feet apart is not possible, especially down here at the clinic. There are just some interactions that require the providers to be more than or closer than 6 feet to you, and that's where the masks become extremely important. But when you can stay 6 feet apart, please do so. And mask is not a substitute for that. The other very important thing is the mask should completely cover the nose and mouth and fit snugly against the sides of the face without gaps. So I grabbed 2 masks to show you. This is just a standard, what we call procedure or surgical mask. And what you can do with this one, it's got a little bit of wire on the top. You want to look for that, have it pressed firmly against your nose, and then you can twist the ear loops, and it looks a little bit like it's kind of poofing out, but I can feel it. It's actually right up against the sides of my face right here. And there isn't a big gap at all. Whereas if I just leave it like this, there's a little bit more of a gap, especially in the lower part right here. This is a cloth mask, a Sasquatch one from our museum, our Makah Museum. It's got a wire on the top. It's got 2 layers of cloth, which we recommend at least 2 layers of cloth. It's also got a little pocket for a filter, but even with just 2 pieces of cloth, I feel pretty safe. And this one's got some, just a little piece of rubber here it's probably plastic, to tighten that up. So I can put that on. And when I do that, fit it against my nose. This one fits actually a little bit better, and there's absolutely no gap right here. So just please make sure your masks are fitting, that they're covering your nose and your mouth. You do not need to remove the mask to talk. If someone can't hear you, then I would much rather you just speak louder or have them come 6 feet so that you don't have to yell. But I have seen some people taking the mask down to talk, and that completely defeats the purpose. So please keep that mask on. We really are relying on it if we do have any outbreak here. And as we know from experience, our masks protected our staff down here in several critical moments when we had positive patients that we were treating. So please make sure you've got your mask on, cover the nose and the mouth. That's what we're looking for when we're seeing if an area is safe. And I do want to normalize, letting someone know that their mask isn't covering their nose or they don't have it on. Don't be afraid to tell someone, hey, your mask isn't on your nose, or hey, your mask isn't on. I know it's uncomfortable to wear one all the time, but it really just should be a part of a normal everyday, hey, your shoes are untied. So anyways, I don't want to go on too much about that, but just really normalizing mask wearing, because that's the best and easiest prevention that we have right now, especially when people are longing to be close to each other. These are just some excerpts from an article from the New York Times. It's somewhat outdated now. It's from the beginning of February, but there is no update. So people with the vaccine still need to wear a mask. Absolutely. This pandemic is not under control yet, even though the trends are going down. That is great. There's no promise that we won't have another wave after this, especially with all the variants that are going out. So here's a picture. I think it's a little blurry, but I got my COVID vaccine and I'm still wearing my mask. Just a reminder, COVID testing is still available and recommended if you are coming from a high-risk area, or if you've had close contact with somebody who lives in a high-risk area or came to visit. And certainly you can call the clinic directly at 2233 if you're coming to visit, or if it's after hours and you just want to call the COVID question and concern line, we will assist you in finding a test. We also have test kits that we can mail people directly if they need them. Okay, so here's the reality. We've got a lot of places opening up. The tribe itself has allowed a few different demographics of visitors, and we want to make sure we're stopping, taking a deep breath, and checking in on our COVID preparedness. So the first check is with your own health, physical, emotional, and spiritual. If you are in your best condition, you will be able to respond better if you do get the virus. So if you have your immune system is boosted by certainly eating healthy, getting plenty of sleep and rest, and drinking lots of water, supplements, if you've been getting supplements from our clinic, all of these things, as well as your emotional and spiritual health, will help your body respond if you do get the virus. They will also help you continue to do the things that you need to prevent having the virus, such as wearing the mask, etc. So please take a minute to check in with that. The second check is to check in with your own close contacts. And what I'm asking everyone to do today is to imagine if somebody diagnosed you with COVID right now. So imagine you took the test, got it positive. How many close contacts would be on your list? So you can go as far back as 14 days. Usually we're looking at, within the last 1 to 2 days from when symptoms started or when you had a known close contact. But for this exercise, do 14 days. If someone said your COVID test came back positive, how many close contacts would be on your list? And if we can get everyone in our community to do that and make sure it's just your household group, then we will be in a good position if we do have another outbreak. So please check in with that. Notice if you're starting to slip or relax. Even if you've had the vaccine, we need to be avoiding close contacts outside of our household group. And then the last is to check in with your household group. Are they staying safe? I have heard a couple of comments, such as all of Nia Bay is one pod, or we're expanding our pod, or hey, can you come join our pod? And that's not recommended. It's not a part of the health order at all. A household group is a maximum of 3 households. And the idea is that within that household, everyone is having those conversations about, am I going to have close contact with anyone outside of the household group? And if I do, I tell everyone else in the household, and we're all aware of the risks and might need to go into quarantine from each other from time to time. But all of these things are going to be crucial if we do end up having another COVID case here in Nia Bay. And I want to be prepared. I want everyone here to be prepared. And it is possible that if we continue to do these things and to check in and keep our close contacts down to just our household group, that if we do get a case of COVID-19, it will not be as scary. It'll only affect a small group of people, and we'll be able to make sure they get the best healthcare and healthcare services. And we will do everything we can to, of course, keep them safe. So please do these 3 checks. If there's anything you got from this today, I want you to do these 3 checks and keep that mask on. All right. So that was a little bit longer than I anticipated, but if you want more info, go to our COVID-19 page on stick.org. We've got our Makah EOC public briefings every Tuesday at 11:30. Would love to see you there. And if you have any questions, please call the COVID-19 question and concern line, 645-6273, area code 360. All right, please stay safe and take care. Sure.